The diet that I chose for the YouTube project was intermittent fasting and its impact on type 2 diabetes. I'm Haley Gilpatrick, and I'll be talking to you about this diet. The research question that I chose was, can the intermittent fasting diet be used to treat type 2 diabetes? First off, let's describe intermittent fasting. The intermittent fasting diet is a form of timed eating schedule. It's essentially alternating periods of fasting and eating for long periods of time. The fasting duration consists of different timing of diets. So this type of diet doesn't limit what you can eat like other diets, it just limits when you can eat. It's also not a consistent everyday diet because the fasting portion is only designed to be performed about twice a week so as not to restrict eating too excessively or to be too unhealthy. So there were 5 eating patterns that I had found, like different forms of fasting. And the first was alternate day fasting. It's fasting every other day, but eating without restrictions on non fasting days. The second one was the 5-2 diet. It's eating without restriction for 5 days, then severely restricting calorie intake for the other 2 days. This is about 500 to 600 calories a day, which doesn't really seem healthy. The third eating pattern was time restricted eating. It's fasting for 12 plus hours during the day and then eating during the other hours. The fourth one was eat, stop, eat. It's a period of 24 hours of fasting just once a week. And then the fifth one was the warrior diet, which is eating only fruits and vegetables during the day, and then one large meal of any kind of food at night. You might be wondering what the purpose is of intermittent fasting, which I was too, and it's to help individuals lose weight and to improve their overall health. Now, in case you weren't familiar with type 2 diabetes, it's the more common type of diabetes, which typically occurs later in life during adulthood, but it's becoming more common in children, actually. This type of diabetes occurs because cells in the body become resistant to insulin and sugar cannot be absorbed in adequate levels. For the causes of diabetes, there's 2 different instances. The first one is that insulin resistance makes glucose build up in the blood, or what is also known as hyperglycemia, leading to the development of type 2 diabetes. For the second instance, the pancreas stops being able to produce insulin in order to keep blood sugar levels managed, which leads to type 2 diabetes. You might be wondering what the difference is to type 1 diabetes. But in comparison to type 2 diabetes, where insulin resistance is at play, the pancreas doesn't make insulin at all in type 1 diabetes. Type 2 diabetes has some risk factors, and these are factors that increase the chance of developing type 2 diabetes. They consist of family history, like genetics, age, it's more common in older people, lack of exercise, obesity, and lifestyle choices like smoking or not eating enough fruits and vegetables. For the people living with type 2 diabetes, this is a chronic disease that once one is diagnosed with it, they have to spend their entire life managing it by eating better, losing weight, and sometimes even by taking medication if the disease is severe. Now we can focus on the correlation between intermittent fasting and type 2 diabetes. Intermittent fasting results in weight loss, which, as stated before, is one of the ways to manage type 2 diabetes. More correlating factors include that intermittent fasting has been proven to reduce insulin resistance, thereby reducing blood sugar and fasting insulin levels. For those who treat their diabetes with medications, this type of diet could be beneficial if they're looking for a way to stop taking the medication. Now we can focus on the breakdown of the details. Since one of the best ways to manage type 2 diabetes is to maintain a healthy weight, intermittent fasting would be an ideal way to control unhealthy weight gain. Restricted intake of calories over time will result in a decrease in body weight and an increase in metabolism, beneficial factors to those with diabetes. Reprogramming the metabolism from using glucose to using fatty acids for fuel is what occurs during the intermittent fasting. The intermittent fasting diet results in reduced leptin levels, reduced insulin resistance, and increased adiponectin levels. These changes reduce the effects of type 2 diabetes on the body. So, for our recommendation, the recommendation is for all individuals with type 2 diabetes to attempt the intermittent fasting eating pattern. This is in order to determine whether or not it improves their quality of life. Those with insulin resistance taking medication for said problem could greatly benefit and even remove the need altogether for medication. Metabolic reprogramming is what makes the most amount of difference in the affected body, a direct result of intermittent fasting. For a more targeted suggestion, the current recommendation for beginners experimenting with intermittent fasting is the 16-8 method, where the fasting period is 16 hours and the eating period is 8 hours, since it is the most sustainable method and geared more toward beginners. But consulting with a doctor is essential before trying out any diet that could potentially harm an individual with diabetes. Thank you so much for listening, and I hope you learned something new.